Okay, so the mayor of Kansas City announcing new rules there to get things back up and running. This is a little different than the other proposals we have heard, right, Taylor?
That's right. So this morning we're joined live by Dr. Dana Hawkinson from the University of Kansas Health System. Dr. Hawkinson, we wanted a medical professional's opinion on this 10-10-10 rule, specifically that 10-minute portion. Talk to us about that, because I think of all the parts of this yesterday, that was maybe the one that got the strongest response from the mayor of having to keep track of people who are there for more than 10 minutes. What's the logic behind that?
Yeah, the logic behind it goes to contact tracing. So if and when we do get more available testing, we are able to find somebody who's ill. They can then help recall maybe places that they went, and when there's contact tracing by the public health investigators, they can go to those areas and look at who else was there during that time and then contact those people. And that's really what that is for, is to help with the contact tracing.
Doctor, as we get closer to these stay-at-home orders expiring, we had a lot of viewers ask us several different questions about masks. A lot of them are saying people not wear them as much. So do we still need to wear masks when we're outside, for example, but not near others? If you're outside walking around and, you know, sometimes you're not around people, but you could be at any moment.
Yeah. I think when you're outside, you don't really need to be wearing masks in that example that you gave. If you're not going to be around other people, if you're just walking on a path and passing people, you probably really do not need a mask. The mask is to help contain any infectious droplets you may have if you are sick and don't know it yet. And it's especially if you're around other people in enclosed spaces. But outside, if you're just by yourself or with your household and there's nobody else around, there's really not a need to use the mask at that point.
Doctor, I think when we go out right now, one of the first things we do when we come back is tell our friends, tell our family, tell our loved ones what the situation was like when we were out, what it was like with the store, what it was like at whatever place we went to. That's one of the first things we talk about. That's going to continue when things start to reopen next week. What do you do if you go to the grocery store, for example, and you're the only one wearing a mask? Everyone down the aisle, everyone is not really paying attention to the same guidelines you are. Is your best option just to get out of there pretty quickly? Should you do anything differently in those circumstances?
Yeah, again, the masks are not mandatory. We understand that. I think the majority of people are moving to some sort of mask, whether it's a tailor-made mask or a bandana. A majority of the people are moving to that. That should absolutely not change anything you do. The most important things that we have to continue to do and remain vigilant now as some of these orders are lifted is to stay home if you're sick or having symptoms. Only go out if you need to. If you are out, it's vitally important that you aren't touching a lot of things, and that you're using either alcohol gel or hand washing as frequently as you can, and absolutely do not touch or manipulate your mask or touch your face. If you do have a cough or sneeze, especially during allergy season, then do it into your elbow or into your shirt. But those are the real pillars of how we are going to move forward and be able to get back to some semblance of normal life. And those are going to fall on the individual to do that, and to be able to train your household to do that. And it's definitely hard with children. But if you are out in those situations, I don't think you really need to turn around and go home. You just have to be vigilant and remember to do those things.
Dr. Dana Hawkinson with us from the University of Kansas Health System. I know, Dr. Hawkinson, you feel like a broken record at this point, the number of times you've said that, but that's going to continue to be important as we head back out and more people start going out on Monday. Thank you very much. We'll talk to Dr. Hawkinson again in about 10 minutes here.